Every year, colon cancer is responsible for over 52,000 deaths in the United States alone. That makes it the second leading cause of cancer-related deaths when men and women are considered together. It's a silent, creeping enemy that often gives no clear warning signs until it has progressed to an advanced stage. But there's also good news. When caught early, the survival rate is remarkably high, and there are preventive measures that can significantly reduce your risk. So, whether you're here out of curiosity, concern for a loved one, or because you've noticed something odd and you're worried, I'm glad you've joined us. Today we're going to shed light on this disease, breaking down everything you need to know about colon cancer, its early signs, risk factors, and why early detection is a game changer. What is colon cancer? Simply put, colon cancer is a type of cancer that starts developing in the large intestine, which is a part of our digestive system. Cells in the large intestine become abnormal and eventually multiply throughout the colon. The colon plays a significant role in our bodies. It's responsible for absorbing water and electrolytes from the food we eat, transforming what remains into stool, and eventually expelling it from the body. Colon cancer typically begins as small, benign clusters of cells known as polyps. Over time, these polyps can become colon cancers. It's important to note that not all polyps become cancerous, but all colon cancers start as polyps. This is why regular screening to identify and remove polyps is a crucial preventive measure. The early signs of colon cancer. I get it, discussing bowel habits isn't exactly a popular dinner table conversation, but here's the thing. Awareness of these small changes could potentially save a life. Number 1, changes in stool. Our bodies have their unique rhythms and minor fluctuations are normal, but when you find yourself asking, is it just me, or has my stool been different for a week now? That's your cue to pay attention, and by different, we mean various changes. You might see stool that's narrower than usual, kind of like pencil thin, or you may find that you're having diarrhea or constipation more often than not. And keep in mind, it's not just about frequency. Look out for changes in stool consistency, shape, and even color. Number 2, rectal bleeding or blood in stool. On to the next early sign, which is rectal bleeding or seeing blood in your stool. Now, I know this may sound a bit alarming, but it's crucial to discuss and understand. You see, blood in your stool might appear as bright red spots, or your stool might be a darker color like black. Now, not to gross you out, but it might also make your stool look like tar. Remember, though, this symptom doesn't necessarily mean you have colon cancer. Hemorrhoids, for instance, are a common cause of rectal bleeding. However, it's definitely something you should take seriously and report to your doctor immediately. They can help pinpoint the cause and rule out cancer if possible. Number 3, persistent abdominal discomfort. Moving on to another sign, persistent abdominal discomfort. This could include cramps, gas, or pain that doesn't seem to go away. Sometimes we all experience stomach aches, and it's easy to dismiss them as just indigestion or an effect of that super spicy taco you had for lunch. But if you're frequently dealing with abdominal discomfort that's out of your usual pattern, it's time to let your doctor know. Number 4, a feeling that your bowel doesn't empty completely. It's like you've gone to the bathroom, but there's still a persistent feeling that you need to go. Now, this could be related to a variety of factors, but if it's a consistent sensation that's deviating from what's normal for you, it's worth having a conversation with your healthcare provider about it. Number 5, weakness or fatigue. Now, we all have those days when we're just not up to anything, right? But what we're talking about here is an unexplained, persistent fatigue that doesn't get better with rest. If you're constantly feeling tired without a clear reason, like changes in sleep patterns or increased stress, it's something to bring up with your doctor. Number 6, unexplained weight loss. If you find yourself losing weight without any changes in diet or exercise, it's something to note. While shedding a few pounds might be a cause for celebration for some, when it's unintentional, it could be a sign of something more serious. But don't panic just yet. These symptoms don't automatically mean you have colon cancer. They can be caused by a variety of factors, from dietary changes to other health conditions. Now let's talk about early detection and why it is so critical when it comes to colon cancer. First and foremost, when detected early, treatment is more likely to be successful. Early detection also allows doctors to remove polyps before they have the chance to turn into cancer. Let's look at some statistics to illustrate this point. According to a study, the 5-year survival rate for localized colon cancer, which is cancer that hasn't spread outside the colon, is about 91%. That's a testament to the power of early detection. So what happens if colon cancer is not detected early? Over time, the cancer cells can invade the wall of the colon and spread to the lymph nodes and other parts of the body, such as the liver and lungs. This is known as metastasis, and it can significantly complicate treatment and reduce survival rates. This underscores the vital importance of regular screening and early detection. Now, let's discuss the risk factors associated with colon cancer. Our first risk factor is age. While colon cancer can affect individuals of any age, it is most commonly diagnosed in people over 50. This does not exempt younger individuals from concern, but rather emphasizes the importance of regular screenings as we age. Another significant risk factor is family history. If a first-degree relative, such as a parent, sibling, or child, has been diagnosed with colon cancer, your personal risk may be elevated. It's important to discuss your family medical history with your healthcare provider to ensure appropriate preventive actions are taken. A third risk factor is having a personal history of inflammatory bowel disease, which includes conditions like Crohn's disease or ulcerative colitis, is another risk factor. These conditions cause prolonged inflammation in the colon, which can potentially lead to cancer over time. This shouldn't be a surprise, but diet also plays a role in colon cancer risk. Research suggests a diet high in red and processed meats may increase your risk, whereas diets abundant in fruits, vegetables, and whole grains could potentially reduce your risk. Lastly, let's discuss lifestyle factors. These include physical inactivity, obesity, smoking, and heavy alcohol use. All of these behaviors can contribute to an increased risk of colon cancer, underscoring the importance of maintaining a healthy lifestyle. It's vital to understand your personal risk when it comes to colon cancer. By recognizing these risk factors, you can take preventative measures, have informed discussions with your doctor, and ensure that you get screened when necessary. The process of diagnosing colon cancer. As for the process of diagnosing colon cancer, it begins with a thorough evaluation of your medical history and symptoms. This is usually followed by a physical examination and some diagnostic tests, which may include a colonoscopy, blood tests, and imaging studies like a CT scan. If a suspicious area is found, your doctor may perform a biopsy, which involves taking a sample of tissue for further examination under a microscope. The results of the biopsy can confirm whether cancer is present and determine the type and stage of the cancer. It's critical to remember that having symptoms does not necessarily mean you have colon cancer. However, getting those symptoms checked out can provide peace of mind and potentially catch any issues early when they are most treatable. Doctors recommend that people start getting screened for colon cancer around age 45, and even earlier if you have a family history of colon cancer. How you can reduce your risk of colon cancer. Incorporate a variety of fruits, vegetables, and whole grains into your diet. These foods are rich in vitamins, minerals, fiber, and antioxidants, all of which can contribute to preventing cancer. It's important to choose a diverse range of fruits and vegetables to ensure you receive a wide spectrum of nutrients. If you drink alcohol, do so in moderation or consider avoiding it altogether. Women should limit their alcohol intake to no more than 1 drink per day, while men should limit it to 2 drinks per day. Quit smoking. Speak with your doctor about strategies that can help you quit smoking successfully. Engage in regular exercise most days of the week. Aim for at least 30 minutes of exercise on most days. If you have been inactive, start gradually and progressively increase your activity level. Before beginning any exercise program, consult with your doctor. Maintain a healthy weight. If you are already at a healthy weight, focus on sustaining it through a balanced diet and regular exercise. If you need to lose weight, consult your doctor for advice on healthy methods to achieve your goals. Aim for gradual weight loss by increasing your physical activity and reducing your calorie intake. By implementing these lifestyle changes, you can take proactive steps to decrease your risk of colon cancer. Remember, your health is your wealth and knowledge is the first step to prevention. Thank you for joining us today, and if you enjoyed our video, smash the like button and subscribe for more healthy life tips.